Paul St. John, thanks for sitting down with us today.
Thank you for inviting me.
You're welcome. In our practice of natural dentistry, we have a formula for health. The formula is structure plus nutrition minus toxicity equals health. I wanted to discuss with you structure, as I know it is central to your approach in treatment. What does structure have to do with pain relief?
As a practitioner of massage therapy, I get people out of pain and help keep them comfortable in their everyday life. My practice involves having a thorough understanding of human anatomy, bones, nerves, and muscles. This is the structure that I deal with on a daily basis and in all walks of human life.
So then you're mainly dealing with manipulation of soft tissues, like muscles, which move or hold the structure in a certain form?
Muscles only do two basic things. They contract and they relax. When they contract incorrectly, they eventually go into spasm and cause the nervous system to send a message to the brain. And that message is, hey, something is not right here. Pay attention. That's basically what pain is saying. Muscles attached and depend mutually on bones to work with them correctly. This is where the practice of neurosomatic therapy comes in, as our existing school is dedicated to teaching how to normalize the biomechanical patterns of the body and stabilizing the normal structure of the body on the mid-sagittal, coronal, and horizontal planes. These planes that we see right here, the mid-sagittal, the coronal, and the horizontal planes.
So you're trying to normalize the skeletal structure the person has to get it level and perpendicular in relation to what? Gravity?
Well, gravity is important because everything has a center of gravity, even a dachshund. And in the human body, this little black dot that we see right here represents the center of gravity from an anterior-posterior view to a side view. This is the body rotating around that center of gravity, and here's the body tilting around that center of gravity. So everything has a center of gravity. Anatomically, abnormalities such as a short leg is extremely important. This is called a postural abnormality. And when a person moves off their center of gravity, it affects everything because there's a series of cause and effect relationships that go on. They may do this in any one of 6 dimensions, as the body is a 6-dimensional object. They may either tilt off the center of gravity, rotate off the center of gravity, flex off the center of gravity, extend off the center of gravity, or obliquitize. And let me show you what obliquitize means. And that means in the pelvis here, when these iliums move at oblique angles, that's what obliquity means. It also happens in the cranium with the temporal bones. And this is a normal part of our structural exam for all patients that we see here at the St. John Clark Pain Treatment Center.
This must have quite an effect on the rest of the body.
Quite an effect is an understatement. You're right. It sets up a whole series of cause and effect relationships that work their way down the postural chain and also up the postural chain. For example, you see a person who has a short leg that creates the formation of bunions in the feet, especially on the short leg side. As the body rotates the short leg foot laterally, and it does this to give the body a broader base in order to maintain balance. Well, when the foot externally rotates and you start 10,000 times a day, moving not in a direct pattern of the foot like this, but at an oblique angle, then it causes the great toe to bend in and the formation of a bunion. This is a very important concept to understand. This adaptation helps the body be more stable, as there's always more weight bearing on the short leg side. This additional weight bearing on the short leg side causes also a waddling gait pattern because gravity will always push you towards the short leg side. And this bilateral cross pattern, and by that I mean it breaks down the bilateral cross pattern, because the waddling pattern causes the arms to go from side to side instead of in a cross pattern. Waddling has a lot of effects. The spine was never made to go from side to side. It's the same thing also if the pelvis flexes too much and projects. You'll see some people walking with their head going forward. And these patterns cause the great toe, for example, to bend laterally in the foot, as we talked about, as in the pushing off on the inside of the foot. This distortion may also cause cartilage damage in the knee, as the knee will not be properly aligned to the tibia. This inside of the foot movement will cause the torsioning in the knee joint as the toes push off.
Very true, Paul. Structure is a key component of health. That's what we've been trying to say. How come other people are not addressing this?
Well, in analyzing scoliosis, x-rays, we see over 95% of these x-rays never include a complete visualization of the pelvis to embrace the ball and socket joint. So if what you just see is a crooked spine and the x-ray is cut off about here, you never see that this ball is lower than this ball. And that is one of the great tragedies of just taking x-rays incorrectly. This makes it impossible to accurately establish the cause of scoliosis because we cannot see if one leg is anatomically shorter than another. We see this in pediatric x-rays a lot. About 95% of them are cut off like this. And then we label these scoliosis patterns idiopathic. They're idiopathic because we're idiots. If we just would extend the x-ray down another foot, we would see the whole pelvis and see that's what's causing, if you're just looking at the spine tilting instead of looking at the pelvis tilting, then we would see that that statistic, by the way, 57% of people are walking around with 5 millimeters or more. Think about that. But yet when we take the x-ray, we don't include the pelvis. And since the spine is attached to the sacrum and the sacrum is cradled by these iliums, it's very important to visualize the whole pelvis.
It's hard to believe that almost 60% of us have this going on in the body. Where'd you come up with that number?
The statistics are in a retrospective study done by Dr. Gary A. Knutson, where he took already peer-reviewed studies, 7 studies, and put them together. This very important way of analyzing leg length inequity was analyzed by Dr. Janet Travell, MD, and David Simons, MD, in their landmark book, Myofascial Pain and Dysfunction, the Trigger Point Manual. The Knutson study is incredibly important because it was a retrospective study. That's a peer review of a peer review, where he combined 7 previously peer-reviewed studies, which represented about 3,000 patients. And in the 7 studies, the researchers had placed the central beam of the x-ray in the correct position over the trochanters right here that we talked about. So when the beam is put over the trochanters, it goes right through the ball and socket joints. So these studies showed that the greater the difference in millimeters in leg length difference, the greater the patients experienced increased pain. And the increases in orthopedic damages to their spine also increased proportionally to the greater distance in leg length inequity. Another important conclusion of the study is that it revealed that 90% of the people are walking around with an anatomical leg length difference, as well as 57% of those people have a leg length difference of 5 millimeters or more. Now, biomechanical studies have shown that 5 millimeters or more of leg length difference will actually cause orthopedic changes in the spine, as well as the disc, as well as the joints. So the greater the difference in leg length, greater will be the muscular accommodation that occurs, as well as the damage to the discs and the joints. And by muscular accommodation, I mean the greater the spasm, the greater the pull of tonus. The bigger the difference in leg length, the muscles have to accommodate more. So there's more pull of tonus, there's more muscular pain, there's more pull on the joints. And this is extremely important. Now, Knudsen broke this study down into 4 millimeter groups. 0 to 4 millimeters difference in leg length represented 43% of the population, which means that 57% of the population was walking around with 5 millimeters or more of structural leg length difference. The study revealed that not only 10% of the population had no leg length difference, and 33% of the population had from 1 to 4 millimeters of leg length difference, which is not enough compression to cause orthopedic changes. But the moment you go over 5 millimeters or more, this is enough concussion to cause these changes to occur, not only in the joints, but in the discs themselves. Our research has shown that if we put a shoe lift in the short side for young people before they are done growing, that the body will start to grow the balance of the leg length difference in that body. That is, let me explain that. What I mean by that is that, see, there are these growth plates called epiphyseal joints, and they occur here in the femoral head and down by the knee. When the pelvis is tilted towards that side, these growth plates are actually compressed. When we put a lift in here and lift that up, it decompresses that joint, and the body itself starts growing the short leg anywhere from 1 to 4 millimeters a year faster, depending on how much the children don't walk around barefoot. If they use their lifts, these epiphyseal joints on the short leg side decompress. Every 6 months we see these children to reevaluate them. Then we lower the lift as the body begins to make up the leg length difference as a result of decompressing the epiphyseal plate on the short leg side that had previously been compressed. This is extremely important, and we should be evaluating all children this way because we can prevent so many tragic orthopedic unnecessary surgeries that occur later on in life. And also compression to the TMJ joint, because these forces go all the way up the postural chain into the cranium. They have an effect on these misaligning the cranium, because in a human cranium there's 2 to 3 millimeters in each one of these sutural joints. And you see how many of them there are in the cranium. So it starts to remodel the cranium itself. It starts to reshape the position of the condyle of the jaw in the temporal bone. This is very important to understand that the cranium is not a solid structure until after we die. It has a lot of structural accommodation built into it.
So does everyone accommodate the same way to having a short leg?
The 3 ways that the pelvis adjusts to an anatomically short leg is that 1, it will tilt. 2, it will tilt and rotate towards the short leg side. And 3, it will obliquitize, that the iliums will move in an oblique angle towards the short side. So the answer is no, everyone does not accommodate the same way. Although these forces of physics tend to react the same way. But some people are, for example, young girls. They don't have the muscular mass that young boys do. They are even more prone to experiencing extreme changes in the spine because they don't have the muscular support. That's one way. There's a difference between how a short, stocky, muscular person will oppose these forces as opposed to a long, linear body. Although there are other reasons for idiopathic scoliosis, such as mineral imbalances, by far the greatest reason we have found for the formation of a scoliotic pattern is an anatomical leg length difference called LLI, leg length inequity. This difference will work its way up the postural chain into the cranium and also down the postural chain, causing collapsed arches and a distortion in the joint in the ankle called the talus joint. So a variety of ankle problems and foot problems and distortion patterns will occur as these forces move their way down the postural chain.
Paul, this data is incredibly important, but I know it's being missed by many others and can have a tremendous impact on their successes with patients.
Well, you're exactly right. If chiropractors, orthopedists, neurologists, podiatrists, dentists, pediatricians were aware of these facts, as I just stated to you, we could literally save hundreds of billions of dollars in healthcare costs, not to mention preventing the human suffering that goes on with ruptured disc and herniated disc and joint breakdowns and headache patterns caused by misalignment of the upper cervical vertebrae, chronic back pain caused by misalignment of the lumbar spine and vertebrae, and the needless destruction of the hips and knees joints, and also the TMJ joint and the TMJ dysfunction, as well as occlusal misalignment prevalent in your profession. So in a nutshell, what we're talking about here is how the forces of physics work on the human body. It affects the science of motion as well as the performance of the soft tissues of the body, all sorts of myofascial pain syndromes. As we have evolved the science of neurosomatic therapy, we have found that we need the help of two professions more than any other. One is a podiatrist who understands these principles and the need for the necessary foot orthotics in order to prevent the collapsing of the talus joint and the distortion of the feet, which causes pronation or supination distortion patterns. And secondly, the dentist who understands the principles of neuromuscular dentistry and the role of a distorted occlusion relationship that it has on misaligning the jaw as well as misaligning the cranium and the upper cervical region. As you know, the teeth are like gears and they fit together, and how these gears fit together will determine how the condyles fit in the jaw and are positioned in the temporal bones, and how these temporal bones can then be misaligned, causing sleep apnea, breathing problems, such as mouth breathing. As you know, the teeth come together many thousands of times a day, not just from chewing, but from swallowing. So every time a person swallows, the teeth comes together. And this happens several thousand times a day. If our teeth come together in malocclusion position, then the cascade of dysfunction that occurs, that we have just talked about, will reshape the cranium, and all the maladies that we just mentioned will occur because the teeth are like gears. And so if they meet in a dysfunctional position, that dysfunctional position and those forces work their way into the cranium, misaligning the cranium, affecting the neurology of the cranium and the brain itself. That's how important this is. And we now have the instrumentation to measure these forces and their effect on the nervous system.
This information on structure is an undercut or basic that explains or helps us understand a lot more about physical medicine.
The principles that we have just talked about involve the laws of physics, and these laws should be a very integrated part of physical medicine, because one cannot separate form from function in science any more than one can separate the psychosomatic mechanism from psychology.
Addressing structure with patients that come to see us is a major part of our approach. But it takes a lot of education and demonstration, as structure is a very limited part of established dentistry.
Well, generally speaking, most dentists are not taught that there's anything relevant to dentistry from below the level of the jaw. But of course, this is not true, because the body is an integrated, dynamic, self-changing mechanism. Everything that happens to us, whether it is emotional or structural trauma, it affects the muscles. And how the muscles pull on the skeletal system is important to the whole overall paradigm of the body. The structural system has no properties of propulsion. Bones only go where muscles put them. I mean, the bones in this finger are moving because muscles are moving them. But when a muscle is stressed over a period of time, they will accommodate and misalign the body structure. Hence, without looking at the dynamics of muscles, many professionals, including dentistry, chiropractors, and orthopedists, are missing valuable principles that they should be integrating into their disciplines. The most important thing we have learned in evolving the science of neurosomatic therapy is, 1, the body is integrated. 2, the neuromuscular system is integrated in such a way that is a dynamic force that misaligns and distorts the body's physical function. To tell you the truth, the average NASCAR driver knows more about the relationship between form and function than do physicians. A NASCAR driver knows that if a small change in the angle of the spoiler on the back of that car has occurred, it will cause that car to become malfunction dramatically. And if the body is moved off in any of these horizontal planes, starting with the ankle and then going up to the pelvic girdle and then further into the shoulder girdle and then into the cranial base as well, this changes the total integrity and the integrated function of the body. In our standard posturology forms, we find very few people who are properly positioned on the horizontal planes, as well as the mid-sagittal plane and the coronal plane that divides us from front to back. The first thing we do is to evaluate every patient to see if they have an anatomically short leg, because we're aware of the statistics that the Knudsen study has provided us. The average person is taking about 1,000 steps per day, and that means that they are like having 1,000 mini whiplashes. And if we have 5 millimeters or more of leg length difference, which is the case in 57% of the population, imagine what this is doing. It's like a drop of water hitting concrete over and over and over again. Well, the individual drop is insignificant. But after this happens thousands and thousands of times, that force becomes great enough to break up that concrete. The force of walking unevenly in great enough repetition will create orthopedic changes and deterioration. These cause and effect relationships are so important to understand. Someday, through projects like this, every dentist, every physician will know something about evaluating the structure of the human body. Hopefully, they will understand that this is a six-dimensional object and that there is a structural component to every disease process. When that happens, the big winner will be the child humanity and our future generations. And I really appreciate your efforts to awakening your colleagues in the dental profession to the truths we've discussed here today.
Paul, thank you very much.